today I'm talking about Dr. Morstein's protocol for GERD. Now, GERD is gastroesophageal reflux disease. It's very common. It occurs when the stomach contents reflux back up through the lower esophageal sphincter, which is the sphincter that connects the esophagus to the stomach. So it's supposed to be tightly closed, so that doesn't happen. We're going to talk about what happens when it's not so tightly closed. The acid and the food can reflux back up to the esophagus, to the throat, to the mouth, and even into the nose, the sinuses. Statistics are pretty scary that on average it looks like 19 to like 28% of Americans have GERD. What is that about? Now, GERD signs and symptoms include the classic heartburn, coughing, especially after meals, because the acid can get into the bronchial tubes, right? And start making people cough. This is a classic way that heartburn at night, people would wake up in the middle of the night with asthma attacks, and that's likely believed to be the acid getting into the bronchioles and causing enough inflammation, it actually initiated asthma. Now, a lump in the throat feeling, bad breath, hoarseness, increased sinus infections, crazy. And then, of course, there can be stomach pain, nausea, vomiting, as the stomach isn't very happy itself. We can diagnose this obviously through signs and symptoms, but also they'll do a esophagogastroduodenoscopy, an EGD, and a lot of times they can see the acid, either seeing the acid. There's also changes in the esophagus, precancerous called Barrett's esophagus that they can see that is from acid washing over the esophageal tissue, which it shouldn't do. So it's not hard to diagnose GERD. Of course, with conventional docs, if you come with kind of some of those symptoms, they probably will just recommend an antacid. And if your symptoms go away, bam, it's got to be GERD. The conventional ways of treating this is with stomach neutralizers. That's acid neutralizers, and that's things like Tums, right? Rolaids, right? These just neutralize acid, and then generally more acid comes out, and they have a temporary effect. In 1978, they came out with the H2 blockers, and those block the histamine from creating acid in the stomach. Those are about 70% effective at stopping acid production. There's really just one nowadays, the famotidine, the Pepsid. We used to have another one, Zantac, but that was taken off the market and hasn't come back on. Then there are the typical drugs called the proton pump inhibitors. The proton pump inhibitors are drugs like omeprazole, pantoprazole, lansoprazole, all of these drugs that shut down stomach acid production up to like 98%, which is really horrific to think about. It does shut down symptoms, but we're going to talk in a second about how problematic that is for the body as a whole. There's also something called link surgery, where they kind of put these magnets in, right, like at the bottom of the esophagus, right by the sphincter, and it just closes it up, right? So just kind of artificially preventing stomach acid from getting back through up into the esophagus. Now, blocking stomach acid with PPIs is effective to control GERD, but it has tremendous negative side effects that have been seen in observational studies. Guess what stomach acid is needed for? Well, it is needed to absorb iron, calcium, B12, magnesium, folate. So there's nutrient deficiencies, right? We can also have poor digestion of proteins because stomach acid is not a digestive enzyme, but it activates pepsinogen to turn into pepsin, and pepsin is a digestive enzyme specific for proteins, which is the vast majority of what the stomach is designed to help break down. Well, without stomach acid, we may not be making much pepsin, so that can be a problem. When we inhibit calcium, guess what? They have an increased risk of fractures. With B12, you can get numbness and tingling and many conditions of B12 absorption. Iron, you can become anemic because the stomach isn't emptying well. It inhibits the migrating motor complex, and that slows digestion down and increases your risk for developing small intestine bacterial overgrowth. On PPIs, you have an increased risk of food poisoning because stomach acid can kill some bacteria in the food. You have an increased risk of gallbladder disease. You have an increased risk of pneumonia. You have an increased risk of kidney disease. And the worst of all, you have an increased risk of dementia. So yeah, not a good thing to be on long term. How do I work with patients who present with GERD? Well, gonna start off by looking at the diet. There are many things that can aggravate GERD and weaken the lower esophageal sphincter from tightening, such as caffeine and alcohol and chocolate, and then some healthy things like peppermint. There are some things like citrus or tomato can just aggravate things when that's going on with the GERD. And just bad diets are a problem as well. So we're going to just start from the get-go and tidy all of that up. Now, being overweight or obese puts more pressure upwards, such as pregnancy as well, and that can cause GERD. Well, we're obviously just going to let pregnancy play out, but with the overweight and obese, obviously losing weight will stop the upward pressure and help reduce the GERD. We're going to look at food sensitivities. So I find food sensitivities are main causes of GERD, right? And when we remove the food that seems to be the troublemaker, then people can add in a lot of the other foods that they have problems with, like citrus or chocolate or tomato sauce or things like that. So we just have to find the one food that seems to be the irritant. Also, too much acid may cause GERD, but honestly, as we get older, that's generally not the problem. It may oftentimes be not enough acid because we need a certain amount of acid to stimulate the closing of the lower esophageal sphincter. If we don't have enough acid, we may not close it fully, and then even though we don't have much acid, it can still go up and cause the irritation up into the esophagus and above, right? So we have to look at, is there not enough acid as a primary cause? So naturopathic treatments, definitely looking at the diet, removing the food sensitivity. Increasing stomach acid. Now, we don't just always have to give stomach acid. And as we get older with seniors, we want to be really careful giving stomach acid because guess what? You can cause an ulcer in seniors giving them stomach acid. And whatever you do with stomach acid, do not, and I mean really, do not, I'm looking at you, do not take one stomach acid and say, oh, I don't have burning. I'm going to take 2 stomach acids. Oh, I don't have burning. Oh, I'll take 3 stomach acid capsules. Oh, no burning, and etc. until you burn, and then just take that one less per meal. This is erroneous. It was made up by a doctor. It's not scientifically valid. I have seen maybe 6 patients who got ulcers taking 7 hydrochloric acid pills with each meal because 8 made them burn, right? Now, there was a researcher in England, Nigel Plummer, and he did research where if you have low acid, you need to add about maybe 1,200 or so. If you have no stomach acid, you need around 2,200 milligrams. So we do not need enormous amounts of stomach acid to replicate what the human body puts out for a meal. However, you don't even need to start with stomach acid. We can do bitters, gentian, orange peel. There are many herbs that are bitters that stimulate the stomach to make hydrochloric acid and actually stimulates the rest of the digestive tract as well. With bitters, you want to taste them. So you want to put like a tincture or a spray in your mouth like 5 or 10 minutes before you eat and let that flavor, that bitter, you know, just make you, make those stomach enzyme and also the other enzymes, right? You can also, some people do apple cider vinegar, right? So apple cider vinegar also seems to be helpful in this regard. My recommendation, just don't drink the teaspoon or a tablespoon, or get capsules. Companies like Nutriflare that have literally apple cider vinegar that you can swallow. Avoid destroying the enamel of your teeth and irritating your esophagus, and just have it open up in your stomach. And then, of course, we can do hydrochloric acid if we need to, and pepsin. We also do a lot of soothing botanicals, slippery elm powder, marshmallow powder. These can just be made as teas. You can do them as capsules, but the teas are better. Licorice, so anti-inflammatory. Plantain and fumaria are anti-inflammatory, specific to the stomach and digestive tract. This whole thing just sets up a lot of inflammation. So we calm it all down. And taking combination products like that before meals really can settle the GERD down and the symptomatology. Obviously, as I said, weight loss as well. And also some basic things like don't eat a big meal and then decide, oh, I'm going to bend over a lot. Like, not very good. And many people, at least to start with, might want to get a wedge in their mattress so that they're sleeping just a little elevated to keep the acid from, on a level surface from particularly getting into the mouth, getting into the bronchial tubes during the night. So this is Dr. Morstein's protocol for GERD. It's great. I love it. And that's all I have for today. Hope to see you again. Take care. I'm Dr. Mona Morstein.